Introduction to Healthcare by Michelle White. Today's healthcare is not only complex, it is significantly different from what it used to be. Some key points. Principal factors in the debate over healthcare include cost, quality, and access. How to provide quality services while minimizing costs. How to measure quality service and ensuring healthcare is easily accessible to everyone. Another key point is the recent healthcare reform policy measure that includes the Affordable Care Act. Affordable Care Act, or ACA, also referred to as Obamacare, which includes the protection of patients' privacy. Another point is how healthcare functions as an industry. Yes, it functions much like a business. It does this by using the MCO approach. MCO stands for Managed Care Organization. Managed care has an administrative structure that serves as an intermediary between the healthcare provider and the consumer. The administrative structure regulates the expenditure of resources of the healthcare provider. The major development. Before the 20th century, most relied on folk remedies to treat their patients. Training standards emerged by the mid-1800s, and the Civil War brought forth changes in the way medicine is practiced and procedures were done. From the 1900s to the 1950s, public health advances with the objective to protect all Americans and their communities from preventable serious health threats, especially communicable diseases. Many were left with no means to pay for medical services, so this era also brought forth health insurance to make sure that medical services were affordable and accessible. In 1965, President Lyndon B. Johnson announced his program to create Medicare and to launch his war on poverty with Medicaid. These new programs had the goal of improving health care for the poor and aged, because at this point they had limited access to quality medical care. With the next era, which was from 1980 to the present day, came the arrival of corporate care. Even though standalone hospitals were starting to disappear as the large corporate networks came to define medicine, the government redirected its policies toward privatizing publicly funded institutions, and hospital systems were integrated into larger healthcare networks, which included ancillary healthcare-related businesses. Marketing practices included direct-to-customer advertising for pharmaceuticals and medical devices increased significantly. Some of the stakeholders and their roles include, for example, the providers. The providers play numerous roles in the overall well-being of their patients. In addition to providing assistance in physical needs, healthcare providers offer advice and direction for illness prevention and injury. Another stakeholder is the patient, of course, and the patient is the one seeking the assistance for their illness. Another stakeholder is the employer. The employer assists the patient by providing affordable insurance and also sometimes by paying a portion of the premium. This concludes my overall introduction of the U.S. healthcare system.